Chapter 4 Cholinergic drug Parasympathomimetics Cholinergic drug Parasympathomimetics Cholinergic drug Parasympathomimetics. These are the drugs which mimic the effect of parasympathetic postganglionic nerve or those of acetylcholine. These are also called as cholinergic agonist or cholinomimetics. These drugs also have agonist action on cholinergic receptor at autonomic ganglia, neuromuscular junction. Classification: parasympathomimetic drug direct parasympathomimetic drug to three types: direct acting or ganglionic sympathetic or direct acting. Indirect acting. Direct acting cholinergic esterase, acetylcholine, methylcholine, bethanacol, natural alkaloid, muscarine, pilocarpine, ericoline, ganglionic stimulant, nicotine, labeline, phenyltrimethanium, PTMA, dimethylphenylpyrrolidinium, DMPP. Indirect acting anti-CH agent, reversible anti-CH agent, organophosphate, diisopropylfluorophosphate, DFP, difluoromalathion, parathion, tabunum, serine, somum, all very gases. Carbamate, carbonyl salvin, propoxybagon, reversible anti-CIT agent, carbamate, neostigmine, physostigmine, serine, hydrophonium, pyridostigmine, eclidine, tecrine, cholinesterase, acetylcholine, ACH. Although it is essential for maintenance of body homeostasis, it is not used therapeutically for two important reasons. It acts simultaneously at various tissue sites and no selective therapeutic response can be achieved. Its duration of action is quite brief because it is rapidly inactivated by the cholinesterase. Methacholine, acetyl beta methylcholine. It is a synthetic polyester used occasionally in human therapeutic but infrequently, rarely employed in veterinary medicine. Methacholine causes muscarinic effect on cardiovascular function similar to those produced by ACH, but it is considerably less active on GI system. Methacholine lacks nicotinic action. Methacholine is a cholinomimetic of choice for controlling tachycardiasis of atrial origin. It will cause slowing of heart, reduction of the force of contraction, and generalized vasodilation. Main site of action of methacholine is the pacemaker. Carbamyl choline. It is an extremely potent choline ester that is active at both muscarinic and nicotinic receptor and therefore cause pharmacological effects similar to change evoked by ACH. These are particularly prominent on the nicotinic receptor of autonomic ganglia. However, the drug is also very potent at muscarinic site. For instance, intravenous injection of dosage as small as 2 microgram per kg causes a transient slowing of heart rate and hypertension owing the muscarinic effect. Carbachol is sometimes used for the emergency transmittant of colic in the horse and ruminal stasis in cattle. Administration of carbachol is done with great care and the drug is given in repeated small doses of 1 to mg subcutaneously. Bethanacol carbamyl methylcholine. It is somewhat similar to methylcholine and carbachol. However, it is primarily a muscarinic agonist and has little stimulant effect on nicotinic receptor. Table showing properties of cholinesterase. Cholineester, hydrolyzed action, selective action. Acetylcholine positive, 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 positive. Methylcholine positive, negative, positive, positive, negative. CS. Carbachol negative, negative, positive, positive. GIT bladder. Bethanacol positive, negative, negative, positive, negative. GIT bladder. Therapeutic use of cholinesterase. Therapeutic usage of cholinesterase. Esters. Therapeutic usage of cholinesterase. Methacholine and bethanacol are not used frequently in clinical veterinary medicine. Methacholine has been used in human medicine to control tachycardia of supraventricular origin. Bethanacol 1 mg administered subcutaneously has been used to treat urinary bladder atony in cat after incidence of urolithiasis. Carbachol has been used in the treatment of colic and infection of the intestinal tract. It is also used in the treatment of ruminal atony and infection in cattle. However, none of the above have proved satisfactory results, so nowadays these are not used clinically on routine basis. Natural alkaloids. Pilocarpine. It is obtained from the leaves of Brazilian shrubs Pilocarpus jaborandi and Pilocarpus microphyllus. It has prominent muscarinic action and also stimulates ganglia, mainly through ganglionic muscarinic receptor. Pilocarpine is particularly effective in stimulating flow of secretion from exocrine glands, including salivary, mucus, gastric, and digestive pancreatic secretion. As with acetylcholine, it causes contraction of GI smooth muscle, thereby increasing smooth muscle tone and peristalsis activity. Of concentration importance, pilocarpine has a potent contraction effect on the pupil. Applied to the eye, it penetrates cornea and promptly causes miosis, ciliary muscle contraction, and fall in intraocular tension lasting 4 to 8 hours. Arecholinine. It is an alkaloid found in the betel nut, the seed of the betel palm. Areca catechu. It has muscarinic as well as nicotinic action, including those on skeletal muscle and blade. It is similar to pilocarpine in scope of activity, but is considerably more potent. It stimulates secretion of the gland of the digestive tract and increases peristalsis movement of the gut. Increased flow of the saliva occurring within 5 minutes following a subcutaneous injection and lasting for an hour is particularly noticeable. Arecholine contracts the urinary bladder. Muscarine. It is found in the poisonous mushroom Amanthia muscaria and has only muscarinic action. It is not used therapeutically but is of toxicological importance. Therapeutic usage of cholinergic alkaloid. Therapeutic usage of cholinergic alkaloids. Clinically, solution of 0.5 to 2% pilocarpine are used for instillation into the conjunctival sac for treatment of glaucoma. Other use of pilocarpine as a myotic are to counteract mydriasis after they have been used for testing refraction and to prevent or break adhesion of iris with lens or cornea by alternating it with mediatics. Cholinesterase inhibitors. Cholinesterase inhibitors. These are indirect active parasympathomimetic agents. They inactivate or inhibit acetylcholinesterase and pseudocholinesterase and thereby intensify the activity of endogenous acetylcholine. Acetylcholinesterase. The active region of acetylcholinesterase form a gorge which contain an aromatic anion site formed by tryptophan and an astratic site formed by serine, glutamate and histamine. Hydrolysis of acetylcholine by acetylcholine esterase. Hydrolysis of acetylcholine involves electrostatic attraction of positively charged electrons and plus acetylcholine to the aromatic pockets and nucleophilic attack by serine, which is activated by the adjacent histidine leading to acetylation of the serine. The acetylation enzyme reacts with water to produce acetic acid and choline. The reaction is very fast. Reversible inhibitors. Mechanism of action. These agents reversibly bind to the active site of the enzyme as they serve as alternate substrate for acetylcholine esterase enzyme. Adrophonium and tecrine attach only to the anionic site of the enzyme, and tecrine inhibited enzyme does not involve hydrolysis of the inhibitor but only its diffusion, so action is brief, whereas physostigmine and neostigmine bind to both anionic and astratic site for the enzyme. So the carbamylation of the enzyme with neostigmine and physostigmine is of longer duration than the inhibition of adrophonium. Thus, during the period where the enzyme inhibitor complex exists, the enzyme will not hydrolyze its natural substance acetylcholine. Physostigmine. It is an alkaloid extracted from the direct ripe seed of a vine, Physostigma venenosum, which grow in tropical West Africa. It is also known as calabar bean or ordeal bean. Nowadays, physostigmine is used for its ability to constrict the pupil or asthmatic and in the treatment of deadly nightshade poisoning. Neostigmine. It is the salt of a systemically produced substance structurally related to physostigmine. It is used as purgative and in the treatment of atony of urinary bladder. Table showing comparatively feature of physostigmine and neostigmine. Physostigmine, neostigmine. Source: calabar bean, synthetic. Chemistry: tertiary amine derivative, quaternary ammonium compound. Oral absorption: good or poor. CNS action: present, absent. Applied to high penetrate cornea, poor penetrate. Direct action on cholinesterase: absent, present. Prominent effect on autonomic effectors, skeletal muscle. Important to use: mitotic in glaucoma, myasthenia gravis. Dose: 0.5 to 1 mg man, oral or parenteral. 0.1 to 1% in eye drop. 0.5 to 2.5 mg man, intramuscular IM or IC. Duration of action: systemic 4 to 6 hours, eye 6 to 24 hours, 4 to 6 hours. Irreversible inhibitor. Irreversible inhibitor. Mechanism of action: organophosphates act as irreversible inhibitors of the cholinesterase in mammals. These compounds irreversibly phosphorylate the esteratic site of both acetylcholinesterase and the non-specific or the pseudocholinesterase throughout the body. Endogenous acetylcholine is not inactivated, and the resulting effects are due to the excessive preservation and accumulation of endogenous acetylcholine. Effect and toxicity. Effect and toxicity: organophosphate poisoning produce diffuse cholinomimetic effect, profuse salivation, vomiting, defecation, hypermobility of the GI tract, urination, bradycardia, hypotension, severe bronchoconstriction, and excessive bronchial secretion. These signs reflect excessive activation of muscarinic receptor of postganglionic parasympathomimetic action. In addition to the muscarinic effect, skeletal muscle fasciculation, twitching, and subsequently muscle paralysis occur. These effects are due to persistent excessive stimulation of the nicotinic receptors of skeletal neuromuscular junction, resulting in the depolarization type of straightened muscle paralysis. Convulsion and frequently death are seen in organophosphate poisoning caused by the penetrate of the agent into the CNS and subsequent intensification of the activity of acetylcholine at CNS site. Treatment of organophosphate poisoning. Treatment of organophosphate poisoning. The first line of treatment consists of administration of atropine to counter muscarinic effect of acetylcholine. 0.2 to 0.5 mg per kg body weight, maximum dose 1 mg per kg. It is administered at 0.150% solution of atropine in physiological saline. The second line of treatment involves the use of enzyme reactivators such as diacetyl monoxime DAM, 2-pyridine aldoxime, methionine 2-PAM, or paralidoxime. Obidoxime etc., which reactivate the phosphorylated acetylcholinesterase enzyme and greatly escalated clinical recovery. It also serves to reduce the quantity of atropine required. The usefulness of enzyme reactivators is limited to a short period, minute or hour depending on the compound, because the enzyme phosphate complex become resistant when a further group is removed by hydrolysis, a change known as aging. Therapeutic use of irreversible inhibitors. The only drug indication is the relief of glaucoma, where a single instillation of diisopropylfluorophosphate or ecothiopate act for several weeks. Organophosphate and carbamate are used insecticide for the control of insect, vector, and ectoparasites. Thank you.